So I investigated 2 cases of suspected child abuse in our emergency department, and as nurses and doctors as well, we are mandated to report any suspected cases. And in this situation, one case was reported on and the other case was not. So I investigated why one was and one wasn't, and the outcome of both the cases, and was able to report back to emergency nurses in Australasia the outcomes and where we could work better, and also back to my own emergency department at Bendigo Health on what we should have done and what we could have done, but also what we did well and things we could improve on. Initially, when the child comes in, we just assess them and don't really think about how this has happened, but when we have more discussion with the family that are with the child and also the injuries that we find, then we might think that something has happened that's not natural in this child. So both of the children went to Melbourne, so they go down to the Royal Children's Hospital in Melbourne and they're treated further. These were 2 severe cases of child abuse that were found, but we do see minor things come in as well that we're able to pick up on and report further on. We see a lot of suspected cases of child abuse in the emergency department, and we're usually the first ones that come across it. And I sort of just thought maybe this is something that we could work on. If the patient gets discharged from the emergency department, they're not really followed up. If they do get admitted to their paediatric ward, then there may be a light bulb that goes off in a nurse's head as such, and they're able to, report suspected cases. But if not, this child may represent, and then we go down the same path again. We do have a policy here at Bendigo Health that states where to go to if we suspect cases, so we can have a look at that policy, and that tells us what number to ring, whether it be in hours or after hours. We do have excellent staff here at Bendigo Health that policy belongs to. It's not something that I oversee as such, and I had a look at that policy and made sure it was very easy to read and access. It's quite a lengthy policy just because of the different departments that we can report to, but the staff in the emergency department are well more educated on where to go, what to look out for, what questions to ask without being too forward to the parents or whoever presents with the child, and also who to go to first. So if you suspect something, you don't immediately get on the phone and call someone. You may speak to your senior in the department or the doctor, and you may go down that path. And it does take quite a long time to go through the process, but once you get there, then it's sort of a bit of a relief on you that children are so vulnerable in our society, and if we don't pick things up, then, it may go unnoticed for quite a long time. It's certainly a process that we can start, because this is usually the first point of call for the child. So, trying to help them out as best we can.
Yeah.